Roll call, please.
Counsel Barton.
Present.
President Counsel Cahill.
Present.
President Counsel Capano.
Present.
President Counsel Calucci. President Counsel Creighton.
Present.
President Counsel Seer. President Counsel Ford.
Present.
President Counsel Lozey.
Present.
President Counsel Net. President Counsel Phelan.
Present.
President Counsel Trahan. President, 11 present.
Can we all please rise for a moment of silence? And I am going to recognize and introduce Father Joe Rossi to say a few words from St. Pius Church.
So much has been said about the events of Friday morning, Newtown, Connecticut. It's so hard to add any more words and syllables to describe that horrific day. And yours truly is probably not going to shed any new light on that experience, but it is good for us to pause, to be silent, to think, to pray, to reflect, to dialogue rationally. I'd simply like to describe an experience that I had on Friday afternoon, early Friday afternoon. I was doing sick calls on Friday morning, visiting hospitals and nursing homes who were sick in their own homes. And it was probably around 12:30 when I arrived back at the rectory. And I noticed that the students from our school had gathered in the schoolyard for recess. I simply wanted to be with them, among them. And as soon as I walked into the schoolyard, about 7 or 8 of them saw me and they came running over and gave me a big hug. And I squeezed them about as hard as I could, in a way that I never had before. At one point, one of the little girls in the group looked up to me with beautiful, beautiful blue beady eyes. And she simply asked me, "Why are you crying?" And I could feel the tears running down the crevices of my face. And I said to her, "I'm not crying." She said, "Why are you crying?" And my response to her was, "Because I love you." I really and truly want them to know how much I love them, their teachers love them, and so many others, their parents, so many others as well. It strikes me that 2 of the most basic human needs that we have are the need to be loved and the need to be and to feel safe. And I know that every single person in this chamber, and many, many more beyond this chamber, want that for the youth of our city and for people on all levels of life. The need to be loved and the need to feel safe. May it be our fervent resolve, especially here in Lynn as a city, to keep those 2 needs primary. And to do everything that we can, not just talk about it, but to do everything that we can to reassure those who mean the most to us that we really do care, that we really do love, and that we are committed to doing everything possible to keep those who we love safe. Just a little something to think about in the wake of the tragic events of Newtown, Connecticut this past Friday. Thank you so much for allowing me to come here today and share an experience that I will never forget, and I hope you won't as well. Thank you. Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
Communications, please.
We have one communication from Your Honor the Mayor. Dear Councilors, I'm hereby appointing Mr. Lester McLean to replace Mr. George Nimbletace on the Lynn Council on Aging. Mr. McLean's term is effective immediately and will expire on August 9, 2018. Sincerely, Judith Flanagan Kennedy, Mayor.
Motion made and seconded. Discussion. Roll call.
Council Barton?
Yes.
Yes. Council Cahill?
Yes.
Yes. Council Capano?
Yes.
Yes. Council Calucci? Yes. Council Creighton? Yes. Council Seer? Yes. Council Ford?
Yes.
Yes. Council Lozey?
Yes.
Yes. Council Net?
Yes.
Yes. Council Phelan?
Yes.
Yes. Council Trahan?
Yes.
Yes. 11 yes.
Public hearings.
First public hearing, abandonment of a portion of land along Saunders Road at 78 and 82 Saunders Road, and we have a recommendation from the planning board to approving the abandonment.
I'd like to open the public hearing to anybody wishing to speak in favor. Anybody wish to speak in favor? Anybody in favor? Seeing no one wish to speak in favor, close the public hearing. Oh, excuse me.
I would be polite or be alive. I'm Jeff Crosby. I'm speaking for the New Lynn Coalition, which I'm a director. It includes a number of organizations in the city. And the coalition, Neighbor to Neighbor, Lynn United for Change, a number of groups. And I live at 34 Thistle Street.
Okay, I just want to make sure, and I probably wasn't clear. This public hearing is on the abandonment of 78 and 82 Saunders
I
Road.
mistake. Thank you.
It's some, you know, there's a number of different things on the agenda that's not a problem. Look forward to hearing from you.
Thanks.
Anybody else wishing to speak in favor on the abandonment on Saunders Road? Seeing no one else wishing to speak in favor, close the public hearing for all those in favor. Open the public hearing for anybody in opposition. Anybody in opposition? Anybody in opposition? Seeing no one wish to speak in opposition, close the public hearing for all those in opposition. Close the public hearing. Council Lozey.
Mr. President, thank you. I attended the planning board meeting, and this abandonment is for a small portion of land. Saunders Road at this point is a dead end at this location. The roadway is not at its full width. Residents wanted to widen their driveway. They were unable to because it's city-owned property. By abandoning this, it would permit the residents there to widen their driveways. So I would ask my colleagues to support this abandonment. Thank you.
I'll take that in the form of a motion. Do I hear a second? Second. Discussion. Roll call.
Council Barton?
Yes.
Yes. Council Cahill?
Yes.
Yes. Council Capano?
Yes.
Yes. Council Calucci? Yes. Council Creighton? Yes. Council Seer?
Yes.
Yes. Council Ford?
Yes.
Yes. Council Lozey?
Yes.
Yes. Council Net?
Yes.
Yes. Council Phelan?
Yes.
Yes. Council Trahan?
Yes.
Yes. 11 yes.
Next public hearing.
Public hearing relative to an ordinance amending the zone ordinance of the city of Lynn for medical marijuana treatment centers.
I'd like to open the public hearing for anybody wishing to speak in favor and recognize Chief Coppinger from the Lynn Police Department.
Thank you, Councilor. I have a few comments that I would like to share with you, and we all know this law takes effect January 1st of 2013, just a few weeks away. It's uncharted territory, it's new ground that we have to venture into. We've never been there before. I can't, as your chief, can't tell you exactly what's going to happen, but I gave you some comments, and I tried to do some homework. By speaking to chiefs in other states, particularly the state of California, I was out there in September at a conference of the International Association of Chiefs of Police, and I attended some workshops on this. It's personally spoken with some chiefs trying to get their hands on comments as to what they experienced. I recognize the fact that I'm not an expert in the law, but it's my understanding the law that we recently passed here in Massachusetts is similar to what was passed in California, hence my comments and my questions to my colleagues out there. But I would like to just preface this by saying, it's too bad if with this new medicinal marijuana that it's not being dispensed through, the chain store drugstores. There will be the Walgreens, the CVS. It would make life so much easier. There would be by prescription. Medicinal marijuana is not by prescription, it's by referral. It could be regulated by the FDA. We wouldn't worry about dispensaries. Those that need it could readily get it, as we get all our medications for whatever the malady may be. But that's not going to happen because still under federal law, marijuana is still an illegal substance, and therefore it can't be regulated by the FDA. There's also, as I said, this is uncharted territory, so I suggest you move cautiously, because even if you look at the point, we have to have our Department of Public Health formulate some regulations with this, and this is new law. DPH has until May 1st of 2013 to specify exactly what a 60-day amount of marijuana that can be legally possessed by an individual with medicinal marijuana referral is. I don't know what that's going to be. I can take a guess. I don't know what's that going to be until such time as that is defined by DPH. That's going to affect how we do things on the street, how patients will determine what patients can have. You know, and DPH also has to come up with regulations on how they're going to grow this stuff. Like any business, you know, they have to get their product from someplace. Where are the grows going to occur? How are they going to be delivered? And how are they going to be controlled? Some of that stuff's out there, but there's still some questions. So anyway, going back to my conversations with my colleagues in California, a wide variety of comments were received, and most of them were in the negative. And I want to run my glasses so I can read the thing, but I want to, because I don't want to mess this one up, but on the California Chiefs of Police website, it says, in reference to these medicinal marijuana dispensaries, well-armed and very violent group of criminals seeking to profit from the theft of marijuana and large sums of cash. That's what they want on the police departments you may see in your communities. Just think about it for a second. Somebody with a criminal background wants to rob a convenience store. They're going to walk in the convenience store, do their thing, but their goal is to clean out the till, take the cash in the cash register and leave. They don't care about the cans of soup on the shelves. They don't care about the cigarettes behind the counter. They want the cash. Go into a medicinal marijuana dispensary. You get two goals in there. You want to get the cash because it's a very cash-rich business. There is no regulation that I'm aware of that says you can charge the fees that you have to pay for medicinal marijuana through your health insurance. It's a cash business. There's going to be a lot of cash going back and forth. Plus, the product is there. And don't forget, aside from less than an ounce of marijuana on a person and somebody with a medicinal marijuana referral, marijuana will still be a crime after January 1st. So there's still a market for that. There's patterns of violence associated with marijuana. I was at a meeting today with the Massachusetts Major City Chiefs, which I am a member. Collectively, we all anticipate we're going to see increasing violence in our communities. And let me also say, I hope I'm wrong. I don't have a crystal ball in front of me, and I hope I'm wrong and hope this goes smoothly, because I understand there are patients out there who need this. But, again, speaking to my colleagues in California, there's a lot of fraud. The regulations are loose. There's stories I heard from chiefs that you can get a marijuana referral for stress, for anxiety, athlete's foot. Think about that. And once you have your medicinal marijuana referral, it's good for life. So if Kevin Coppinger has a case of athlete's foot at 30 years old, and it gets cleared up in 6 months, I can get my 2-month supply of marijuana for life. So if Kevin Coppinger decides to go to the dark side, as we call it, and I go to the criminal side, I can make a hell of a profit for myself selling this thing on the side. And this is another story I get from the chiefs out there. Even the legitimate customers, and there are many of them, I'm sure, who go into the medicinal marijuana dispensaries, they're targets for crime. They know they're going in with cash, coming out with product. People rob them, sell it. It's going to make them a profit. Okay. Locally here, in 2010, 2 years after we decriminalized marijuana, we had 3 murders in 2010. 2 of them were marijuana related. Marijuana is still a profitable business for the drug trade. It's not going to go away. It's not certainly. It maybe have a slight effect with this medicinal marijuana, and who knows if marijuana will ever be legalized in this state. As we know, there are states there. But we have to deal with what we have today. Just to turn this a little bit more to maybe make you a little bit more familiar with something that we've experienced here. It increases the violence, it increases the crime, but it also decreases the quality of life in the neighborhoods. And when I heard these stories, it made me think of several phone calls I received from many of you over the last couple of years. Stories I'm hearing, even for the legitimate people who get medicinal marijuana, they leave the dispensary. They go out and they light up. If the dispensary is in a strip mall or in an office building, they make one of the restrooms that light up. They light up in the hallway. Marijuana has a very distinctive odor. We all know that. It's the ventilation system, permeates the rest of the building. Other businesses in those facilities are affected. And they've had those businesses close and move elsewhere. They've had folks where they come out of medicinal marijuana with their marijuana and they sell it. They sell it for money. We even had one place in there, they were selling it for sex. And then the folks who come to hang around. And I'm trying to be careful with my comments here because I understand this is a public forum and I'm on TV. But this is where I go to some of the phone calls I've got from you folks. Lynn is a great city. I'm proud to be a member of the Lynn Police Department. I'm proud to be a resident of this city. We have a lot of social service agencies in the city, and most of them are very good. They provide a service that is needed, particularly folks who have substance abuse. I'm the first one to say that. However, we're a magnet as more and more people come here to use these services. And don't be naive. People who come to use the services, they're all not clean. They still use drugs. They still use alcohol excessively. I have a list in front of me of people who come to Lynn now. They're all over the place, you know. Well, I won't go through the paper yet, but Somersworth, New Hampshire, Framingham, Wellfleet, down the Cape, out west, Springfield. Dozens of them. They're all here in Lynn now. They go to, I've got calls from you folks in some of the western areas and some of the downtown areas. They go, do whatever they do with the social services, and then they hang around. You folks get calls from businesses. Their business is affected because the folks hanging around. Negative business effect. Not going to get any good business or any other businesses in here that are going to thrive. So I can talk up here more. I think I made my points. I know some other folks may want to talk on both sides of the issue. I know it's a very controversial issue. My suggestion again is please go slowly. I recommend that you pass this ordinance. It will restrict it. We'll go from there. If I'm wrong with my comments, if my crystal ball isn't clear, you can always expand it down the road. Take small steps, go slow, and thank you very much. I appreciate it.
Thank you. Anybody else wishing to speak in favor?
Hi, my name is Cassandra Foley, and I work for Girls Incorporated of Lynn. I've been working on substance abuse prevention issues in the city for the past 5 years. Before I say my comments, I'd like to allow some of our youth to speak.
Hello, my name is Victoria Bidet, and I work as a peer leader at Girls Inc. These are my colleagues, Sarah Alexander and Zara Leon, who are also peer leaders at Girls Inc. I would like to start off by saying, data is meaningless if we disregard the people it actually represents. The data is collected is from actual people who are negatively affected by marijuana. With these statistics, we are able to conclude that marijuana will inevitably harm our community. The enhanced accessibility would trash our already hindered perception. 26% of high schoolers, thank you. 26% of Lynn high schoolers and 11% of Lynn's middle schoolers report smoking marijuana in the last 30 days. The fact is, teens are using this drug now, well before the presence of marijuana shops in our community. Research shows that youth are more susceptible to use drugs if they perceive it as not harmful. With that being said, 48% of Lynn's high schoolers and 34% of our middle schoolers would say marijuana is not harmful. If teens look around and see marijuana being marketed in their community as medicine, their perception of its overall risk is going to be lowered. This is a definite way to ensure marijuana rates rise among our teens. Allowing a dispensary in our community sends a message to our youth. Any resident in Lynn can testify there are countless amounts of schools in our city. No matter where the location of these schools, if there's a pot shop in Lynn, it'll become a part of every child's daily scene. 91% of patients admitted for methadone treatment in Lynn report using marijuana at some point in their life, the average age being 13 years old. We live in an age where technology enhances every minute detail of our life. Marijuana is no exception. The marijuana of the 60s is an ancestor to the chemically modified marijuana that is accessible to teenagers today. Simply put, studies point to marijuana being 20 times more potent today than in the 60s. Trying to chase this high often sends our teens down a slippery slope. It is no coincidence that drug addiction and abuse among 12 to 17-year-olds is highest in medical marijuana states. We are not here today to decide the future of dispensaries. We are here to act before this falls into our youth's hands.
Drug deals. We have all walked down the street and seen one take place. Have we not? Sadly, around almost every corner, marijuana in particular is available to teens. Medical marijuana shops would only make the problem an even bigger issue. Other states with the existence of shops have shown that teenagers are highly susceptible to marijuana. How hard would it be to obtain marijuana from someone with a card? Especially since someone with a card has an undefined 60-day supply limit. They can easily, and most likely will, purchase more than they themselves need and sell it to the target audience, teenagers. A 2012 study shows that amongst adolescents in substance abuse treatment in Denver, Colorado, 74% had used someone else's medical marijuana, an average of 50 times. They say history repeats itself, so why would statistics be any different? The idea that things would work out any better in Lynn is unrealistic. Studies show that the majority of people with medical marijuana cards do not have them for severe cases. Reiterating what Victoria had touched upon before, us teens are not all crowded into one gated area. We don't just float from home to school and back again. 1 out of 5 people walking the streets of Lynn is under the age of 18. They, and the generations to come, should not have to think seeing a pot shop to be a normal thing. Yes, pot shops. Giving the shops the title medical marijuana dispensaries glorifies the institution. In reality, it's nothing more than a legal drug deal to those with cards, which will most likely lead to an illegal drug deal to teenagers.
I believe we all work hard to do right in our city. We all give a helping hand to make the city a better place for everyone, one way or another. There are so many positive programs designed specifically for the youth in Lynn to help stay away from drug activity and things of that nature. Every day, we as a whole aim for a more positive and brighter future for ourselves and our community. Yet with all our efforts, there still seems to be something that flags these attempts. Allowing marijuana dispensaries, or to put it very bluntly, pot shops, in Lynn would worsen the situation regarding our perception of Lynn. By creating a zoning ordinance, however, we would maintain the image of our city today that we've worked so hard to achieve.
Thank you, ladies. A few other points that I would like to make on behalf of Girls Incorporated of Lynn and the Communities That Care Coalition, which is a substance abuse prevention coalition in the city that's been working very hard to prevent substance abuse since 2004. The first point that I would like to make is that Lynn is not the only city or town that is considering a zoning ordinance. Many of our neighbors are considering them, and some have already passed them. We've already seen ordinances and full bans passed in Reading, Wakefield, and Saugus and Peabody as well. So with many of our neighbors passing zoning ordinances, that will only make Lynn an even bigger target for dispensaries because the state law will allow up to 5 per county. The second point that I would like to make is that over the past 10 years, the city of Lynn has been granted approximately $2.5 million in substance abuse prevention grants, both from the state and federally, and allowing a pot shop to open its doors in Lynn would be very contradictory to the many prevention efforts that the city takes pride in. Thirdly, I realize that it's very difficult to foresee what this will look like throughout the Commonwealth and for Lynn, especially since, as the chief said, we won't know what the state's plans are until probably the beginning of May. With that being said, a zoning ordinance in place will prevent teens from accessing it. It will prevent teens from seeing illegal drugs on the street, and it will make the city of Lynn look better. Lastly, I want to point out that I do believe that there are many sick people in Lynn and in surrounding cities that do need medical marijuana, but I want to point out that this is also a huge concern for youth access to a federally illegal drug. This drug is still federally illegal, and we've seen in other states that only 5% of card holders in some of the states with medical marijuana laws are actually patients who have cancer and AIDS. 95% of card holders are people who fall into the other conditions clause, as the chief mentioned, for things like headaches and athlete's foot and things like that. So with 20% of Lynn's population being youth, I ask that when you're thinking about what decision you make tonight about this ordinance, that you'll think that 1 in 5 people walking the streets. is under the age of 18. Thank you.
Thank you.
My name is Bob Conley. First of all, it's not easy getting up and speaking for people, and I commend our youth for getting up and saying what they have to. After the recent events in Connecticut, my resolve as a parent was shaken. I'm not naive, but I was vividly reminded that I'm not able to protect my children 24 hours a day. What I do possess is a common sensibility to teach my children right from wrong, in the hope that influences their choices and responses to danger and uncertainty. We as parents constantly struggle with how to explain right from wrong while building confidence and a strong will in our children. Many times, our words fall on the normal, underdeveloped brain capacity of our children. Children learn behavior from personal experience and what they perceive to be acceptable. We as parents hope that the memory of our words and advice penetrate when temptation rears its head. Despite the benefits of medical marijuana may afford chronically ill patients, the fact still remains that this is an illicit drug that can cause harm to our children. The public acceptance of marijuana makes our words as parents more distant in the face of temptation. By allowing a dispensary of marijuana in Lynn in public view of our children's eyes makes marijuana more socially acceptable to their vulnerable thought process. We as a parental society have a responsibility to be aware of exposing our children to the potentially harmful drug. I implore you, as fellow parents, not to allow the establishment of a marijuana dispensary within our city limits. Thank you.
Thank you.
I would like to just speak as a citizen of the community of Lynn. I have much concern. I fear not only that the city's name will be tarnished, but also...
Excuse me, I apologize for interrupting. Could you just state your name?
I'm sorry, my name is Genesis Diaz.
Thank you.
So I'm sorry. So as a citizen of the community, I have much concern, and I fear not only that the city's name will be tarnished, but also the negative effects that the dispensaries can have on neighborhoods. Like many others, I have worked my entire life towards building a positive reputation for the city of Lynn. I've spent years partaking in youth clubs that unite to contribute to the community via volunteering and park cleanups. And it saddens me that I have found drug paraphernalia during park cleanups and believe placing dispensaries in our neighborhoods will only produce more negative results. In fact, areas surrounding dispensaries in other states with medical marijuana laws have experienced an increase in crime, and I fear the same will occur in our community. This is a reality we must face, and keeping the community safe should not be taken lightly. Thank you.
My name is Stephanie Hardy, and I am a Lynn resident and also a student at Boston College. This past year, I voted for the first time, and so I've done my fair amount of research on the topic of medical marijuana, and I'm too concerned with the violence that may take place in the city in addition to the reputation that Lynn already has, including, robberies with dispensaries, people who can grow marijuana in their home. I've read stories about them having shootouts at people's homes, and I just don't want to see that happen in the city of Lynn. Thank you.
Anybody else wishing to speak in favor? Anybody else in favor? Seeing no one else wishing to speak in favor, close the public hearing for all those in favor. Open the public hearing for anybody in opposition.
Good evening, gentlemen. My name is Michael Victoriano. I'm a resident here of Lynn, Massachusetts. I'd like to begin with, I think there's a little bit of confusion. Marijuana is not a drug. It's only classified as such because of the laws that protect current corporations. With all due respect, I think some of the previous people who were up here speaking came up here and weren't more educated on the subject of marijuana and the reason that it's used as medicine. I classify it as a medicine. And in different areas of the world, it's also classified as a medicine. I'm not going to try to get too deep. I'm not going to get into conspiracy theories or anything like that. I'm just going to try to get to my point. I'm a parent of 4 beautiful children, and I raised them to have high morals. But it's difficult for me to vilify marijuana when alcohol is glorified. It's difficult for me to be against marijuana, which I know medicinally what it's capable of doing. It's hard for me to be against it when liquor stores get robbed. It's hard for me to be against it when, in my opinion, alcohol is the gateway drug. Every Sunday, I'm sure there are a lot of big football fans here. Most of us were watching the game on Sunday night. And I'm sure we didn't have a problem throwing back a few cold ones, maybe some hard liquor. The only difference between you watching the game at the house, and being responsible about drinking your alcohol, and someone being at a bar and probably getting riled up was just the venue, in my opinion. And maybe a little bit of responsible thinking. Alcohol is the gateway drug. Alcohol is much more dangerous. We all have our stories, we've all shared stories and heard stories, and we all know the dangers of being drunk while driving. And I'm sure we all, I think that's a fair vilification if you ask me. So we know what that is. If you don't know what the effects of marijuana are on your body, please just do a little bit more research, do a little bit more knowledge. That's all I'm asking of those in the audience and a few members also. The youth can attain alcohol if they really wanted to. I heard that being brought up as a reason to keep the dispensary out of the city. If a minor wants to attain alcohol, they can do it. It might be harder for some, might be easier for others. And if they can't get it from the liquor store, I'm sure some minors have been at parties where it's been offered to them. They've asked for a little bit, but they've definitely been around a group of people who have been partaking in alcoholic beverages. Prevention is not the answer, education is. I'm of the opinion, I don't think we need extra police officers on the streets. I think we need better education. I think we need more attention being paid to our youth. I cannot ignore the youth. I have 4 young children, 14, 9, 7, and 1 year. Again, I'll close with this. It's difficult for me to vilify it when it's glorified. It's difficult for me to vilify something when I have to hide it. I have to hide what I feel should be the real villain. I have to hide that from my kids. Or I have to explain why particular lyrics are coming over the radio station. Or why they're showing this beer commercial. And why these girls in bikinis in the beer commercial. This is way more of a concern to me. I mean, I think as long as people can use marijuana as the medicine responsibly, recreationally, that's another conversation. But if we're talking about medicinally, what I know is that as a medicine, marijuana can replace many man-made drugs, and prevent a lot of long-term complications. I know it can ease the process of chemo, and that's it. Pretty much, I ask everyone, even though it'll get resolved tonight, I just ask everyone to go home, take a little bit of time, just do a little bit more research as far as marijuana is concerned and how it can be a miracle medicine for a lot of people. Thank you.
Thank you. Anybody else wishing to speak in opposition? Anybody else in opposition? Anybody in opposition? Seeing no one else wishing to speak in opposition, close the public hearing for all those in opposition. I believe we have a letter from the planning board.
We have one from the planning board recommending that it be approved, and we also have a letter from Mary Ann O'Connor, the Department of Public Health Director, and she's also in favor of the ordinance.
We can have those entered into the record. What's the wish of the council? Motion made and seconded to approve. Discussion. Council Cahill.
Thank you, Mr. President. Through you to the members, I applaud you, Mr. President, for taking the initiative of bringing this issue to the forefront for discussion. By way of background, as many of you know, I'm a former prosecutor. I've prosecuted individuals for possession of marijuana. I've also prosecuted individuals for the distribution of marijuana. I was proud to be a yes vote with this body against the decriminalization of marijuana back in 2010, I believe. And I've worked with Mayor O'Connor and Girls Inc. and various groups to limit drug paraphernalia in our community. But a strange thing happened on November 6th on the way to the ballot box. I'm looking at the list of question of 3 votes citywide. And in not one precinct in one ward did voters vote unanimously or in the majority against medical marijuana. This is what I gotta say first. 60% of the population, 18,446 voted for medical marijuana, 12,293 against. So when we're faced with an issue like this, where it is a virtual landslide in terms of elections in favor of medical marijuana, I don't take lightly what we need to do here today. And I just want to share with you some of the information that I have gathered myself. Because I'm sure as all of you wanted to do, based on the level of votes, you wanted to educate yourselves. And I listened to Chief Carpenter and what some of the remarks that he made several weeks ago when this first came up. So I looked at the law, I read the law. It is a poorly written law, I can tell you that as a lawyer. I think that was probably by design, but let me just lay out some pitfalls for the city and its officials to kind of take into consideration before we ban medical treatments. One, I looked at California, the differences between California's law and Massachusetts' law. A couple of things struck out. One, there are limits on the number of licenses there should be in Massachusetts. In California, there are no limits. It's also locally controlled in California, opposed to state controlled with the Department of Public Health, promulgate regulations, and regulate medical marijuana. In California, anything goes. Saugus could say you can have 1,000 medical treatment centers, Lynn could say you can have 0, and so on and so forth. So it is essentially the Wild West out there with medical marijuana. In Massachusetts, it requires a bona fide relationship between a patient and a doctor. I've read the Mass Medical Society's opinion, Q&A, FAQs on this. It's still up in the air whether or not a doctor will prescribe this. Unclear whether or not the Board of Registry of Medicine will pull their license to do so. A lot of these things are left unknown. And in Colorado, actually saw a couple of interesting things. Apparently, in medical treatment centers, there is all cash. And the banks won't take your cash because it's drug money. It's a Schedule I drug. They won't process it. So apparently, at these treatment centers, they have cameras and armed guards. And in some studies, they say this crime is depleted or dropped within 2 blocks because no one wants to deal with drugs and do crimes because there's so many cameras outside, armed guards. No one wants to go around treatments that are kind of a strange report, but I don't know if it's true. The chief mentioned to move cautiously. I agree. The Department of Public Health is now promulgating regulations. They have yet to release those regulations. Those licenses won't be released until the Department of Public Health promulgates said regulations. So whether or not this is in place for us on January 1st or February 1st or up to the deadline of May 1st, it may not prevent or have any impact on whether or not treatment centers is located in Lynn. But this gets to my real issue here, why I think this is a poorly written statute on purpose. There is something called a hardship cultivation registration. If I qualify for one of the 3 elements, or satisfy one of these 3 things, I can essentially either grow marijuana myself in my apartment or have John Doe grow it for me. And John Doe can grow it for you, and 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 everybody in it. because there's nothing in the statute to stop anyone from doing it. Now, I have to satisfy three things. One, financial hardship, and anyone will tell you, to grow marijuana, it's expensive. So if you are broke, if you're too broke to buy marijuana from a treatment center, you're too broke to grow it yourself. So I don't believe anyone's going to qualify for that. A physical incapacity to access reasonable transportation. In Lynn, we have buses, we have trains, we have access to transportation. I don't think anyone satisfies that. But here's the third problem. Here's what we have to focus on. You can qualify for a hardship cultivation if there is a lack of a treatment center within a reasonable distance of a patient's residence. I think the individuals who wrote this had no intention of medical treatment centers existing. I think the new cities and towns like Lynn and Saugus and Reading would ban it immediately, or make it very difficult for anyone to actually have a medical treatment center. However, the ramifications of us banning would be essentially that we could all grow it in our homes. That being that we satisfy the three requirements that we meet with a bona fide doctor and they give us a prescription. And I'm not going to get into that. I'm not a physician. And that's between a physician and a patient. And we should be focusing on those who need this medication. It's not medication. It's medicinal medication, whatever you want to call it. And that's a relationship between a doctor and a patient. So I guess my concern is this. If we enact this today, and there are no DPH regulations for which we're basing this on, and we prevented a medical treatment center from being in Lynn, do we open the gates to allow everyone to grow it in their third floor apartments, at which time you're talking about high voltage, we worry about, really we should be talking about restricting and regulating hardship cultivation licenses more than medical treatment centers. We should make sure that people have to come down here and register with the building department, the clerk's office, pay a fee, have their apartments inspected. That's where the danger is. That leads to fires. That leads to proliferation of marijuana in our streets. I'd argue the treatment center actually does the exact opposite. That it condenses things, opposed to allowing people to have this cultivation license. Of course we want to protect children. Obviously we don't want anyone who's underage from consuming alcohol, consuming pharmaceuticals, consuming marijuana. My concern is that doing this today, A, changes nothing tomorrow or January 1 or February. But if we can wait to see what the state releases, we can mirror that restriction and work off that restriction and put in place a proper ordinance for this council. That's all I'm saying. I don't use pot. I don't know, people out there want to use it. That's between them and the doctors. But I would say, move cautiously, as the chief said, and enacting the statute today, or an ordinance today when we can do that in the next couple of weeks, next couple of months, based on department law. Thank you very much.
Thank you, Councilor. Any other comments from the council? Any further discussion? Councilor Craig.
Mr. President, through you to the members, I'd like to agree with my colleagues' concerns on the hardship license. I do believe we should wait to see what the state's Department of Public Health has to say. On the matter, we do have time, we should move cautiously. I won't repeat anything you said, but you articulated very well. So I'd like to make a motion to table and see essentially what the DPH regulations are, and then revisit this once we have a better understanding.
All right, there's been a motion to table which is non-debatable. Roll call.
Council Barton?
Yes.
Yes. Council Cahill?
Yes.
Yes. Council Capano?
Yes.
Yes. Council Calucci? Yes. Council Creighton?
Yes.
Yes. Council Seer?
No.
No. Council Ford?
Yes.
Yes. Council Lozey?
No.
No. Council Net?
Yes.
Yes. Council Phelan?
Yes.
Yes. Council Trahan?
No.
No.